Do you know how many people who have been diagnosed with GERD, heartburn, also have a small airway? But no one's ever checking for that. All they do is give you some medication and throw you on your way. Heartburn and a small airway. A lot of my patients come to me for all kinds of things. Yes, it is airway, and they are having issues. When I see an airway that's really restricted, first, one of the questions I ask them, hey, do you have heartburn? And 9 out of 10 times, they know they do, or they haven't been diagnosed by it, because when they see their medical doctors aren't looking at this. They're not ever looking at root causes. It's so rare, if not basically never, all right? The root cause of their reflux disease is not being addressed. The symptoms, here's some medication, stop eating cottage cheese at night, and have a good day. But that's not the root cause. The real problem is the fact that this guy's got already impending sleep apnea or has sleep apnea. And the reason why a restricted airway would cause reflux disease is when you go lay back at night, and if your airway is really restricted, it takes more negative pressure for you to breathe. Whenever you're breathing air through your nose, you have to create negative pressure to pull the air from the outside in. It's negative pressure. So if you're creating negative pressure through a smaller space, you have to increase the negative pressure. More negative pressure means more pressure on your thoracic cage. What happens to be right here as well? Your stomach. What's inside your stomach? Acid. So if I'm squeezing this when I'm on the horizontal, it's like an accordion. You're just smashing it in, and acid shoots up the back of your throat and gets inside your mouth. You feel that even if you don't taste the acid, it's still there. So you're wondering why you're always getting cavities. Acid mouth. You're wondering why your enamel's dissolving away. Acid mouth. The small airway causes a whole host of issues. GERD is just one of them.